Here are 8 symptoms of depression. Do you ever feel not yourself, even when life looks like the same from outside? What if you could spot the early signs before they snowball into something much bigger? Have you noticed your sleep, energy, or focus shifting for no clear reason? Let's make sense of what those patterns might be telling you. If that sounds familiar, you're not alone. It can drain your energy, blur your focus, and pull the joy from daily life. Let's keep this simple and center on what actually helps. Clear signs, gentle awareness, and next steps to look at. I'm Dr. Syeda Quadri, a U.S. board-certified psychiatrist. Today, I'll walk you through 8 common symptoms of depression so you can notice patterns earlier and choose thoughtful next steps on how to manage things. Major depression is more than a bad day. It's a cluster of changes in mood, interest, sleep, appetite, energy levels, thinking or focus, movement, and self-evaluation. And these often arrive together and linger. Organizations like the WHO and American Psychiatric Association describe depression as common and treatable, with many people improving through a combination of skills, lifestyle support, therapy, and medication. Clinics frequently see symptoms overlap with stress, medical issues, or grief, which is why context matters. Not every low period is depression, and people can have different mix of symptoms. The goal here isn't to diagnose yourself, it's to build a language for what you might be noticing and to reduce the guesswork about when to reach out for help. With a clearer picture, conversations with a clinician or a trusted person become easier and plans feel less overwhelming. Here's an overview of what I use in my clinic, 8 symptoms, each with a simple takeaway and a link to the next sign. So let's get started. Symptom number 1 is persistent low mood. This is a lasting sense of sadness, heaviness, numbness most of the day. Most days of the week for more than 2 weeks. It may show up as irritability or flatness rather than tears, and it often makes small tasks feel real big. Mood shifts can be quiet and steady, not dramatic, but the duration and frequency does matter. Symptom number 2 is loss of interest or pleasure. Activities that used to feel rewarding now feel meh. Hobbies, food, music, or social time don't light up the same circuits, which can confuse people who still want to care but don't feel like it. Reduced interest is a signal, not a failure. So notice where joy has faded. When interest drops, sleep patterns often change. And that's symptom number 3. Sleep changes. So either there's trouble falling asleep, waking up too early, or sleeping much more than usual. The quality of sleep dips even when hours are sufficient, and mornings can feel thick and slow. Sleep timing and quality are key clues. Sustained shifts deserve attention. Sleep shifts pair closely with appetite and weight changes, and that's symptom number 4, appetite or weight changes. Eating more or less than usual without trying, or a noticeable change in weight over time. Some people graze to soothe, others lose appetite entirely. Consistent appetite shifts can signal mood changes. Energy often follows eating and sleep, so that leads to symptom number 5, low energy or fatigue. Energy feels drained, and even after getting a good amount of rest. So your chores start stacking up, and starting a task becomes the hardest part. Body heaviness and slowed momentum are common. Fatigue isn't laziness, it's part of the syndrome and it needs care. Energy and thinking travel together. So symptom number 6 focuses on concentration. So trouble concentrating or indecisiveness. Your focus slips, details go missing, and choices feel foggy. Reading, emails, or conversations take extra effort, and mistakes or second guessing increase. Cognitive load grows with depression. So how you see yourself can shift too. And that leads to symptom number 7, which explores self-evaluation. That is feelings of worthlessness or excessive guilt. Self-talk turns harsh. Small setbacks feel like proof of being not good enough. Past events may replay with blame that's out of proportion to the facts. You notice the tone of your inner voice. There's evidence checking that can soften extremes. So finally, mood can affect movement and space. And that's symptom number 8, which is psychomotor changes. So a sense of slowness or restlessness. Some people move and speak more slowly. Others feel keyed up, fidgety, or unable to sit still. Both are body level signals that mood is affecting momentum. Movement pace can mirror your mood state. It's a real observable sign. So in conclusion, today you learned 8 symptoms: persistent low mood, loss of interest, sleep changes, appetite or weight changes, low energy, difficulty with focus or decision making, harsh self-talk or feelings of guilt, and psychomotor changes. You're not weak, you're a human. Support is a skill you can practice. Seeing patterns doesn't label you, it gives you a language to ask for the right kind of help at the right time. If this clarified things, share it with someone who might need a gentle nudge. Comment with one pattern you've noticed lately. Subscribe for clear, stigma-free mental health explained simply. Just a disclaimer, this video is educational. It is not medical advice. If you have concerns, talk with your clinician.